to the BSW Network. My name is Olivia Nelson, and today on the program, the network will be airing a series of interviews to commemorate the 30th anniversary of the death of notable Canadian Tommy Douglas. This network special report will consist of interviews with both a Canadian historian and a current social worker working in the medical field. So to kick off this morning's program, we will send it to Shanda White with Canadian historian Polly C. Changer.
Thank you, Olivia. I'm here in Fredericton, New Brunswick, with historian Polly C. Changer to discuss the legacy of Tommy Douglas. Polly, can you tell the viewers a little background information about Tommy Douglas?
Absolutely. Tommy Douglas was born in Scotland in 1904. His family moved to Winnipeg in 1910 before returning to Scotland during the First World War. Tommy and his family returned to Winnipeg in 1918. After graduating college, he married and moved to a small town in Saskatchewan. Shortly afterwards, the Great Depression hit, and Tommy became a social activist and joined a political party.
Thank you. Tommy Douglas is well known for his contributions to Canadian politics. Can you explain to the listeners at home what influenced Tommy's interest in politics?
Absolutely. Tommy Douglas's interest in socialism and a social democracy likely started from a young age. As a young boy, he had an infection in his leg, and he was told it would need to be amputated. Fortunately, a surgeon took an interest in his case and agreed to treat him for free, saving Tommy's leg. This sparked his interest in free health care, as his parents would not have been able to afford to pay the doctor to save his leg. Tommy Douglas also witnessed the Winnipeg General Strike and the resulting violence from that. This resulted in Tommy's later commitment to protecting the fundamental freedoms through a Bill of Rights when he was Premier of Saskatchewan. Also, later during the Great Depression, Tommy witnessed many in Saskatchewan unable to afford Medicare and electricity, which led him to join the Saskatchewan Labour Party in 1932. The Labour Party then helped to create the Cooperative Commonwealth Federation, or the CCF, the political party Tommy Douglas would later have great success with.
Can you tell our listeners a little more about Tommy Douglas's political journey?
Well, in 1935, Tommy Douglas became one of the first CCF members of Parliament. He served as MP for 9 years before leading the party in 1944. Under Tommy Douglas's leadership, the CCF won the political election and he served 5 terms as Premier of Saskatchewan. Tommy Douglas's government was the first social democratic government elected in North America.
Could you give some examples of what his social democratic government was able to accomplish for our viewers at home?
Absolutely, Shanda. Tommy Douglas's government was able to pioneer many social programs for the province of Saskatchewan. His government created a publicly owned provincial power company that extended electrical services to isolated areas within the province. They created various crown corporations that competed with those in the private sector. They enacted legislation that allowed the unionization of the public service. They added a passage of the Saskatchewan Bill of Rights that protected the fundamental freedoms and equality rights of persons against abuse from the government and also from powerful private institutions. And of course, the crowning achievement of his government was their implementation of the government-funded health insurance, which was the first of its kind in North America.
Tommy Douglas's government's single-payer health care is probably what most of our viewers know him for. However, we may have viewers who do not know, so could you talk a little bit about the history of his implementation of health insurance?
The roots of this insurance actually started in 1947 when the implementation of Saskatchewan's Hospital Services Plan came into effect. It was the first hospital insurance plan in Canada. This inspired the federal government to follow suit and led to the creation of a national plan. These plans only funded diagnostic services and hospital operating costs, but were a large step forward in subsidizing costs to make healthcare more affordable. In 1959, Tommy Douglas made his plans for Medicare public. His plan would mean that everyone in Saskatchewan would be covered with fully paid, publicly administered health care. Tommy Douglas faced backlash from political opponents and doctors for his Medicare plan. It was not until after Tommy Douglas resigned as Premier in 1961 that Saskatchewan adopted full health insurance. By this time, Tommy Douglas had merged what remained of the CCF with the Canadian Labour Party to create the New Democratic Party. Tommy Douglas led this party until 1971 and served as an MP until he retired from politics in 1979.
We are running out of time in our segment, but as a last remark, Could you fill our viewers in on what Tommy Douglas's lasting legacy is?
Absolutely. While Tommy Douglas was not premier when it came into effect, his Medicare plan that allowed each person in Saskatchewan to receive free health care regardless of gender, class, age, and so on. Lester Pearson's Liberal government at the federal level eventually adopted Medicare based on Tommy Douglas's plans. So in 1966, the entire country of Canada had access to free health care with the enactment of the Medical Care Act. Along with Medicare, a Canada-wide pension plan and rights for unions became accepted across Canada through Tommy's advocacy. Without Tommy Douglas and his government, the Canada we know today would not be realized.
Thank you, Polly, for your time. And now we are going to Olivia on location with our next segment on Tommy Douglas.
Hello everyone, I'm Olivia Nelson with the BSW Network. On this 30th anniversary of the late Tommy Douglas, we have asked Medea Care to tell us about how Tommy's achievements have impacted the profession of social work. Medea currently works at the Dr. Everett Chalmers Hospital here in Fredericton, New Brunswick. It's so good to have you here, Medea.
It's good to be here, Olivia.
So tell us a little bit about yourself.
As you said, I work at the Dr. Everett Chalmers Hospital.
So what kind of jobs do you do there?
I work on a team where we provide counseling, intervention, education, resource referral and advocacy, discharge planning, and supports to inpatients and outpatients, just to name a few. We spend our days navigating how to find resources for people that are often not covered under Medicare or their own personal insurance.
I would like to ask a few questions about how your job is affected by Medicare. As our viewers have previously heard, Tommy Douglas was a pioneer in starting the movement for Medicare in Saskatchewan. This movement changed the lives of Canadians and spread the movement throughout the rest of the country. Why do you believe Tommy Douglas was so passionate about the care of others?
From my understanding, Tommy grew up wanting to care for people. He chose to do this through church. Many of the things that he did, social workers also do as a profession. He talked to people most politicians don't give the time of day during his time in federal politics, and criticized the policies of the government. From my standpoint, there needs to be more of this today. He spoke to people in jails, hospital patients, workers making minimal income, and those using food banks. These are the people who still struggle with access to many forms of resources. This demographic of people involves a group who would never have afforded to get to the hospital, let alone pay the services that it provides.
Do you believe the achievements of Tommy Douglas have benefited your job as a social worker?
Definitely, 100%.
How so?
I have not practiced when Medicare was not around, so I can only imagine the struggle to find services for people at that time. Everything that I do at the hospital is under Horizon Health Network and requires Medicare to be provided with services. Not having to search for funding or ways to help people receive insurance for the basic medical expenses that it covers means that I have time to help find insurance for those that do not have it.
Are there any cons to requiring Medicare for services?
In New Brunswick, you are eligible for Medicare if you have a Canadian citizenship and are permanently a resident in New Brunswick, which seems easy enough. However, there is a list of more than 30 different procedures or types of care that Medicare does not cover, and 5 different groups of people. We are currently having an influx of Syrian refugees attempting to find their way in their new home. There are ways of working around the issue of getting Medicare. However, it makes their lives more stressful in an already stressful time. The list also includes students from other provinces or on student visas. When I attended St. Thomas University, I was covered through my parents' insurance for health care through school. However, if I had been someone moving here with little to no money, trying to find a job, I would not have been able to afford insurance, and therefore, until my move was finalized, I would not have had Medicare.
What about wait times in hospitals? Do you have an opinion on that?
I work with various demographics of people in the hospital with large difference in income. So when you talk about wait times, I think it is important to think about who is complaining to the point where they would rather us not have Medicare at all. No one enjoys waiting for hours at the hospital. However, there's a large portion of people who complain about wait times and don't consider that if we didn't have those wait times and didn't have Medicare, you would have to pay to receive that care. They would not have money for it. There would likely be ways of funding people for checkups, but even now there are surgeries that are not covered with Medicare and require out-of-pocket payments. Another thing is that although it is incredibly frustrating to drive to a hospital where you live an hour or more away, you're already feeling miserable because you were sick, and then you have to wait hours to see a doctor, many people have struggled to find a way to get to the hospital when they couldn't afford it. How would they be able to afford care whenever they arrived if it wasn't for Medicare? There are so many things that people need in life, and having Medicare doesn't just benefit my job. It means you have one less thing to worry about when you are living on next to nothing. As you can see, without advocacy of Tommy Douglas, none of this would be possible.
Thank you for your time, Medea. That's all the time we have for today. Thank you, viewers, for tuning in to this BSW Network special commemorating the legacy of Tommy Douglas. Have a wonderful day.